It takes about 20 years on average for something that we know works in the lab to make it to clinical practice. From my research in translational medicine, it became clear that we're living in the past. The medicine of today is the medicine of 20 years ago at best. I have a postgraduate degree in analytical psychology, and there's something I want to make clear. Everything that becomes institutionalized becomes about control. In art, literature, poetry, music, religion, and especially healthcare. It is about taking away the power of the individual and the individual decisions. I've seen it since 2010 while seeing some of the clinics and doctors where the establishment was actively trying to destroy them with a level of viciousness that honestly surprised me. Something else was at play and was definitely not science. In the case of peptides, I see a particular challenge. It takes upwards of $1 billion to approve one molecule. You cannot patent biology. No company would ever invest the money and the time it would take to go through the three stages of the clinical trials to get an approval of the FDA. No, it will require a great psychological shift in the regulatory bodies to relinquish the fundamental bias of modernity that knowledge only comes through the scientific method in the ultra rational linear thinking of the hyperneurotic mind. Science is a great tool. The problem is if you're a hammer, everything looks like a nail. On Friday the 29th, we're going to go over some of these questions. We're going to do a live demo of Regenesis. We're going to go over your questions. We're going to learn how to bring knowledge back to the individual so you can walk into a provider's office with the right questions and protocols. And he will thank you. You know, Regenesis is not the end, it is the beginning of a clinical conversation. So every clinic owner on this call will get a complimentary strategy session with the MSC Access team. We'll send you an intake questionnaire. You book a 60-minute call with us, and we'll map out what your clinic's first 90 days with regenerative protocols looks like, what to lead with, what to charge, how to position it. This is the same intake we run with our paid clinical clients. So for every non-clinician, if you're not a doctor and you join us on Friday, you're going to get one free pro-level personalized clinical roadmap. So you can upload your lab reports, imaging summaries, prior practitioner notes. Regenesis generates a complete clinical roadmap, evidence graded, with the questions to ask your provider, the metrics to track, and the terrain assessment most consumers never get done. It's yours to take to the next appointment. So see you on Friday. If you have not asked the question, please do so on the form below, included in the email you received from us. So see you then. Cheers.